Hello, I am Dr. Tae-Young Han from Banyong Insu Clinic. Today, I present a remarkable case of an inflammatory myofibroblastic tumor that achieved remission through Sasang typology after surgery failed.
The timeline spans from 2004 to 2013. It is a story that begins with a successful initial surgery, follows with a life-threatening recurrence, and concludes with non-surgical remission. Our patient was a 10-year-old boy. After his tumor aggressively returned, he reached an inoperable state. It was then that a decade-long journey of stabilization through integrative medicine began.
This rare clinical success was published in the Journal of Clinical Pediatric Hematology-Oncology, documenting cases where alternative medicine offered hope for intractable childhood tumors. This case was officially reported by Professor Hee-Young Shin of Seoul National University Hospital. Faced with a surgical failure and an inoperable relapse, he referred the patient to my clinic for a specialized protocol.
The patient's clinical journey began in summer 2003 with sharp abdominal pain. By early 2004, the situation worsened into severe indigestion and a rapid weight loss of 4 kilograms.
In May 2004, a 3-centimeter mass was found near the gallbladder and duodenum. He underwent surgery, but as we will see, this was only the beginning of a larger crisis. Initially, after the first surgery, we aimed to shrink the residual tumor using a standard pharmacological regimen and a strict dietary overhaul at Seoul National University Hospital.
Early radiographic evidence showed some improvement in the duodenal wall thickening, suggesting a brief period of hope after the first intervention. Anatomical mapping during this period confirmed the tumor's dangerous location at the intersection of the gallbladder, liver, and the first portion of the duodenum. Looking at the long-term data from 2005 to 2013, we see a decade of radiographic stabilization that eventually followed our integrative intervention. But before that stability, we must revisit the baseline. The initial symptoms were sharp, pricking pains that standard herbal remedies could not fully suppress. This preoperative CT scan from May 2004 captures the moment just before the first surgery, when the tumor was still considered a localized duodenal issue. The first surgery involved a cholecystectomy and mass excision. It was a complex procedure centered between the gallbladder, pylorus, and the duodenum. During that May 2004 surgery, a pylorus perforation occurred, requiring an immediate omentopexy. The surgeons realized then that the inflammation was extremely severe. Biopsy results confirmed the presence of dense neutrophil infiltration, a sign of the aggressive inflammatory environment surrounding the tumor site. The diagnosis was confirmed, a predominantly fibrohistiocytic type IMT. This was a pathology known for its difficult and unpredictable behavior. Then the crisis struck. In September 2004, just months after the surgery, CT scans revealed a shocking truth. The tumor had effectively doubled in size. This was the aggressive recurrence. The tumor had now spread extensively into the duodenum, liver, and pancreas, invading multiple vital organs. The status was officially declared inoperable. Oncologists compared the surgical risk to that of terminal pancreatic cancer, leaving the patient with no conventional options. The rapid recurrence happened only 5 months after the initial surgery. It was a complete surgical failure that put the young boy's life at immediate risk. The prognosis was dire. With the tumor infiltrating multiple organs and surgery deemed too hazardous, the medical team searched for an alternative answer.
It was at this terminal stage that Professor Hee-Young Shin referred the patient to me. On November 16, 2004, we initiated the MSG-0500 protocol immediately.
The response was extraordinary. By April 2005, only 6 months after starting our MSG-0500 therapy, the recurrent mass showed a distinct and verifiable reduction. This success proved the potential of our integrative approach. The tumor began to shrink, even without any standard Western oncological medications during this period. The integrated protocol combined Professor Shin's strategic guidance with our specialized grain-heavy diet and the targeted MSG-0500 formulation. By April 2005, we saw a dramatic regression of the gastric wall thickening and a significant reduction in the surrounding inflammatory changes. Our timeline shows the mass shrinking from 53 by 38 millimeters down to 43 by 34 millimeters in just a few months. Radiology reports from February 2005 noted that the previously collapsed lumen was opening up, indicating that the tumor's pressure was finally receding. 6 months after Professor Shin's referral and the start of MSG-0500, we achieved partial remission and the complete resolution of the boy's agonizing pain. Over the next 5 years, longitudinal assessment confirmed that the infiltrative lesions remained dormant. The crisis had been successfully averted. This case synthesis proves that the MSG-0500 protocol can achieve sustained stabilization even in cases of aggressive, inoperable surgical recurrence. Scientific analysis shows that IMT is driven by ALK gene rearrangements. This creates a fusion protein that forces cells into a state of constant growth. In 2004, targeted drugs were nearly a decade away. Our protocol bridged the lethal gap, providing a path to survival for this 13-year-old patient. We analyzed the root cause as metabolic overload. Lipid accumulation in the liver had triggered chronic inflammation and systemic insulin resistance. This environment created a pathological equation: runaway cell proliferation combined with blocked waste clearance, forming a fibrotic tumor. The patient's background as a butcher's son meant he was exposed to a diet excessively high in meat, which served as the primary environmental trigger. In the Hee-Young constitution, this meat-heavy lifestyle leads to extreme lipid retention, making the body a perfect host for fibrotic tumors. We identified a metabolic shift. When intestinal sodium levels drop in yin constitutions, the body instinctively favors lipid absorption over nutrients. This low sodium state leads to high lipid intake and excessive fat in the liver, which we now know is the starting point for cellular reprogramming. The patient's genetic profile, the WW code in Sasang typology, confirmed his foundational vulnerability toward this specific type of tumorigenesis. The final architecture of his condition was a fibrotic mass. His inherent tendency for hypertrophy culminated in the localized hepatic tumor we observed. This process was sparked by inflammation. Excessive lipids secretes free fatty acids that bombard the cells, inducing severe insulin resistance. Lipid saturation alters the cellular microenvironment, priming the body for the pathological signals that lead to tumor formation. This triggers mTOR overdrive. The runaway signal causes protein and lipid synthesis to spike, while stopping the cell's natural cleaning process. As autophagy is inhibited, waste piles up. The cell is forced into a permanent pathological growth state, which we call the mTOR shift. Then comes the ALK amplifier. While fat doesn't start it directly, the chronic inflammation creates the ideal fog for ALK signaling to thrive. This synergy creates an unstoppable cascade of proliferation commands, locking the tumor in a cycle of aggressive survival. Once active, ALK dramatically multiplies the growth signals, fueling the runaway PI3K-AKT mTOR axis that drives the tumor's expansion. Our comparison shows how the patient's environment of high lipids and low sodium suppressed his natural cellular defenses. Because his waste clearance process was blocked, toxic materials accumulated at the tissue level, fueling the tumor's structural remodeling. The pathological continuum is a flow from fat to signal to structural change. In a Hee-Young body, this pathway is destructive and clear. We call this the dual-engine convergence. mTOR provides the accumulation, while ALK provides the proliferation, leading to catastrophic remodeling. Chronic inflammation surges TGF-beta signals, which wake up dormant fibroblasts. These cells then physically rebuild the liver into a fibrotic tumor. This unified continuum shows that the young boy's tumor was not a random event, but a direct result of metabolic imbalance and dietary triggers. In conclusion, by reversing the metabolic flow, we reversed the tumor. This success offers a new paradigm for treating terminal, inoperable cases.